Pure Robin sequence, or Robin sequence, is a congenital condition that affects approximately 1 in 8,000 live births. The primary physical finding is a small lower jaw. And the reason it's called a sequence rather than a syndrome is that rather than being a single genetic entity, it is a physical exam finding that then leads to a series of other symptoms. So the primary finding is the small jaw. This leads to tongue collapse, and the tongue collapse then leads to airway compromise. And those are the three characteristics that define Pierre Robin sequence. This typically gets diagnosed near or shortly after birth, and we discover that the patients don't have the capability of breathing well, especially when they're sleeping. These patients range from mild to severe. Mild cases just have a little bit of airway obstruction that can be treated with positioning, typically on their sides, and that provides enough relief by pushing the tongue out of the way with gravity. Severe cases have really severe obstruction. We have a multidisciplinary team dedicated to treating patients like this, which includes sleep doctors, myself, the plastic surgeon, and the old standard of care involved doing a surgery to pull the tongue forward. However, technological advances and surgical advances allow us to try and treat the anatomic etiology, which is the small jaw. These can be as early as 3 months. And through surgery that involves pushing the jaw forward with small devices implanted, we're able to actually lengthen the jaw, pull the tongue forward, and treat their anatomic abnormality forever. This is actually an incredibly powerful surgery. Parents typically say our child is a totally different being. They're able to sleep well, they have more energy, they're able to feed. And so this is a really transformative surgery for these patients.